CSR.
So good afternoon, everybody. Unfortunately, my previous speaker did not realize that sometimes economics trumps evidence. We live in India, and some of our patients don't understand all these criteria and the evidence behind it. So first, let me present the case. This is a 39-year-old tailor who had a decreased vision since about 7-8 months, and he came to us. So this is his fundus picture and the OCT that shows fluid, and this is the autofluorescence and the FFA, which shows a small leak. It doesn't leak profusely, it's a small leak, and there is RP atrophy all around from the chronicity of the disease. So this is the leak that has grown in the later phases. So I'll ask the audience, what do you think we can do for him? Should we do PDT? Yes. If I have learned to regenerate the RP, I will start doing PDT, because already the PDT is bad, the RP is bad in this case, and I am a little jittery when I am trying to think about doing PDT. Of course, he will not be able to afford it. That's a different story altogether. Should I use Avastin? Is it going to help? Yeah, it helps my colleague Dr. Mallika. I don't think it may help the patient too much. And what about micropulse? Tickle business, does it work? Don't really know. I don't have micropulse. So another option that we have, and which has been around since and has lots of publications behind it, is eplerenone. And the first paper came out in 2013, and after that subsequently we have several papers which have used both microperimetry and other multimodal imaging to prove that eplerenone, and for that matter other these mineralocorticoid agents, work. So this is the most important factor sometimes in our patients, and almost 90% of our patients cannot afford PDT, because this is the cost of the PDT and this is the per capita income of India. Do you want me to him to hand over half an year's salary for a treatment when I have an option? Or do I need to buy a micropulse laser even when I have an effective option? When the drug works, why do I need fancy stuff? So this is the treatment result. With eplerenone, over 3 months, the patient has absolutely flattened and it has become normal. So let me ask you again, this is again another case, a young driver who has a CSR with nearly almost subfoveal leak, it's almost parafoveal. Do I bankrupt the patient? Do I damage the RP choriocapillaries? Do I inject without justification, possibly even go to jail or lose the eye from endophthalmitis? Do I bankrupt myself and buy costly equipment with little use when already I have an effective treatment? Or do I use eplerenone, be safe, stay happy, and stay friends with the patient also? Thank you.
Dr. Ajay is going to defend about micropulse.